Healthy lifestyle counseling is an important step in the treatment pathway of non-communicable diseases and involves counseling for behavioral changes such as quitting tobacco use, quitting alcohol use, increasing physical activity, and eating a healthy diet to address the behavioral risk factors of NCDs. Healthy lifestyle counseling involves the use of specific, structured, and evidence based techniques to motivate the patients or clients to undergo behavior change. Healthy lifestyle counseling should be given to the patients or clients at every encounter with a healthcare worker, irrespective of the level of care. Even though it is an essential part of the management of NCDs, it is currently an underused strategy by the healthcare workers in the management of patients with NCDs or clients with NCD risk factors. Therefore, we shall look into the details of healthy lifestyle counseling in this module.
Healthy lifestyle counseling is an important step in the treatment pathway and involves counseling for behavioral changes such as quitting tobacco use, quitting alcohol use, increasing physical activity, and eating a healthy diet to address the behavioral risk factors of NCD. Healthy lifestyle counseling involves the use of specific, structured, and evidence based techniques to motivate the patients or the clients to undergo behavior change. Healthy lifestyle counseling should be given to the patients or clients at every encounter with a healthcare worker, irrespective of the level of care. Even though it is an essential part of the management of NCDs, it is currently an underused strategy by the healthcare workers in the management of patients with NCDs or clients with NCD risk factors. Thus, we shall look into the details of healthy lifestyle counseling in this module. At the end of this module, you will be able to understand the basics of counseling and motivational interviewing in promoting healthy lifestyles in primary health care. Employ the 5A and 5R technique to target specific healthy lifestyle changes. Healthy lifestyle counseling includes the use of specific, structured, and evidence based techniques to motivate patients or clients to undergo behavior change. However, it is important to understand that behavior change is difficult. Behavior change counseling, understanding the process of behavior change. The stages of change model will assist in understanding the behavior of change process. Motivational interviewing, which is an approach used to motivate the patients or the clients to undergo behavior change, and implementing brief interventions, which is a short interaction between you and the patient or the client. There are two types of brief interventions that can be used for healthy lifestyle counseling: the 5A's approach and the 5R's approach. We will talk about these components of behavior change counseling now. First, understanding behavior change and its stages. Behavior change is a complex issue, and various models have been used to help understand it. The stages of change model, also known as the trans theoretical model of health behavior change, is one such example. According to this model, behavior change is not a one off event, but rather a set of different stages through which a person moves. To promote a healthy lifestyle, you should understand these stages of change model and identify which stage of change that the client is currently in. That would help to target a brief intervention toward the needs of that particular client. Behavior change takes time, and different people go through the stages at various pace, and some may remain indefinitely at one stage. Even though a person intends to start or maintain a new behavior for various reasons, they may move back to an earlier state, which is called relapse. Relapse into an old behavior does not necessarily mean a failure to change. Many people who eventually adopt a new behavior make several attempts before it is maintained over the long term. In the pre contemplation stage, the person is not intending to start changing in the near future. He or she may not be aware that his or her current behavior is the problem. They may be in denial, may not feel confident about his or her ability to change. In the contemplation stage, the person is seriously considering change. They recognize the current behavior as a problem and start to consider the pros and cons of changing the behavior and may have mixed feelings about making changes, may see costs as outweighing the benefits. This stage can last for years. In the preparation stage, the person is ready to change. He or she collects information about the problem and options to address it. They may experiment with small changes and may have concerns about possible failure. In the stage of action, the person starts to make changes. During the maintenance stage, the person maintains the behavior. It is important to keep in mind that relapse or recycling is not a stage and it can occur at any point where the patient or the client returns to any of the previous behaviors and he or she may feel disappointed, frustrated, or tired. You, the primary healthcare worker, therefore, should understand the principles of motivational interviewing to motivate your patients or clients to change their current behavior. Now, let's see how to use motivational interviewing to trigger behavior change. Motivational interviewing. This is a style of talking with a person that can help in motivating them to change. In motivational interviewing, the primary healthcare worker does not try to convince the person to change. Instead, you shall guide the clients to reach conclusions by themselves and draw out the internal motivations for change that are unique to the person. Most people experience some uncertainty or unsureness or have mixed feelings about changing their current behavior. They have some reasons to change and some reasons for staying the same, and may therefore remain caught in the middle, unable to change. Motivational interviewing encourages people to explore these mixed feelings so that they can move towards a positive change. Motivational interviewing meets people where they are in the stages of behavior change. This means gaining an understanding of the person and their circumstances so that the healthcare worker can adapt this communication approach to the person's current behavior change stage. The following key principles and techniques can be used to guide the overall approach of motivational interviewing. Do not tell the person what to do. Telling people what to do can result in resistance. The client should be the one to decide that they need to change and how they will do it. In motivational interviewing, rather than taking the role of an advising expert, you become a partner. You and the client will work as a team towards the goal of behavior change. Listen and show empathy. In motivational interviewing, the client does most of the talking. You have to listen and show that you understand the patient's situation without judging or criticizing. Empathy can be described as getting into the person's shoes to understand how they think, feel, and see the world. Empathetic listening creates an environment of acceptance and respect that helps the clients to be open and explore the reasons for their current behavior and options for change. Help the clients see the gap between where they are and where they want to be. This is also called developing discrepancy by asking questions about the client's goals and values and then about the behavior and its consequences. You may help the client to see the difference between their life as it is now and the way they want their life to be. Let the client tell you that they need to change. Rather than telling the client that they need to change, you may draw out the client's thoughts and feelings, helping them to find their own reasons for change and ways to start the change process. Help the client to feel confident about changing. By this point, if a person is convinced of the need for change but does not feel confident about succeeding, they may not even make an attempt to change. The client needs to believe that the change is possible. This is called self belief or self efficacy. You can support self efficacy by highlighting previous successes or strengths that the client may already have. Role with resistance. During a counseling session, a client might show resistance to change in different ways. For example, by interrupting, becoming defensive, or appearing to lose interest. This is an indication that you need to adapt the communication approach. Direct confrontation or argument should be avoided. Rolling with resistance means acknowledging the resistance and adjusting to it. For example, by expressing understanding the client's point of view, acknowledging personal choice and control, and redirecting the conversation. You, as primary healthcare workers, play an important role in helping clients change their unhealthy behaviors and maintain healthy behaviors. Short interactions with the clients, called brief interventions, would help this process. A brief intervention is a short interaction of 3 to 20 minutes between the healthcare worker and the client, aiming to identify a real or a potential problem, providing information about it, motivating and assisting the client to do something about it. These brief interventions can be conducted utilizing two key components. The 5 A's brief intervention model helps people who are ready to change their behavior. The 5 A's are ask, advise, assess, assist, and arrange. The 5 R's brief intervention model helps to increase motivation among those who are not yet ready to change their behavior. The 5 R's stand for relevance, risks, rewards, roadblocks, and repetition. Now, let us summarize the 5 A's intervention model. In 5 A's brief intervention model, the healthcare worker would help someone who is ready to change. Firstly, ask. You may ask questions on the most important aspects of the behavior risk factors from the client in a friendly manner without being judgmental. Then, advise. You would provide the minimum key messages in a clear, simple, personalized manner, linking the advice to something relevant to the person. Assess. Find out whether the client is ready to start making changes to their behavior. As an example, you may ask, do you think you will be able to quit smoking? Here, if the client says yes, you can move on to the next step of assisting their change. If the client says no or not sure, that indicates that the person is not yet ready to change. In that case, more effort is needed to increase the motivation for the behavior change. If the person is ready to change the behavior, assist or help the person to develop a plan to change the behavior. Here, further information would be given to the client to help him or her identify situations that could trigger relapse, discuss ways to cope with trigger situations, and provide encouragement for the change. Then arrange. Arrange a follow up meeting or refer to a specialist service if necessary. The cycle then continues. The 5 R's are areas that should be addressed in a brief intervention to help people who are not ready to change at this point. These people are in the pre contemplation or contemplation stage of behavior change. If the person does not want to change or does not think that the change is important, focus on the relevance, risks, and rewards. As an example, you may ask, do you think your current eating habits have any effect on your life or health? To show the client that there is a relevance between the eating habits and his or her health status, then you may highlight on the risks. To show the client that there is a relevance between the eating habits and his or her health status, then you may highlight on the risks. These risks, then you may highlight on the risks to their health by the current behavior. You may ask, can you tell me about a few adverse effects or risks that would be brought by your current unhealthy eating to your health? This would allow the client to think about the risks related to his or her current behavior. Then you may ask, can you think of any benefits that could happen if you made some changes to your eating habits? Allowing them to think about positive outcomes or rewards. Rewards that they can achieve by changing their current behavior. If they are considering to change their behavior by now but do not feel confident about being able to achieve it or have mixed feelings about it, focus more time on roadblocks. As an example, you may ask, have you ever tried to change your eating habits in the past? Are there things that make it difficult to change your eating habits? Can't you think of ways to reduce these difficulties? This would allow the client to acknowledge the challenges and encourage the person to think of various options to overcome those. Then, repetition. Summarize that you have already discussed with the client and ensure that the client understands that he or she can change the current behavior. As an example, you may ask, do you think you like to change your eating habits to help you achieve a healthier diet? Do you think you can successfully make changes to your eating habits? If the client is ready to make the changes, then assist them to make the changes as we previously discussed under 5 A's model and arrange for follow up. If the person still remains unwilling to start making changes to their diet, then end the discussion in a positive way. Assure them of your support and invite them to return for further discussion if they change their mind. Provide health education material. At the next visit, ask again whether they are ready to make the changes to their behavior. Here we summarize the process of utilizing 5 A's and 5 R's brief intervention models for behavior change of a client. As we have already discussed, while applying 5 A's model at the assess stage, identify whether the client is ready to change his or her behavior at that moment or not. If the client is ready to change the current behavior, continue to other stages of 5 A's behavior change model. If the client is not ready to change his or her current behavior, then use the 5 R's model of brief intervention. With that, I hope you got a glimpse on healthy lifestyle counseling.